Afternoon. I'm Craig McNally, Senior Counselor at the University of Technology, Jamaica, and I am so delighted to welcome you to our Mental Health Forum. Today's forum is hosted by the Faculty of Education and Liberal Studies, specifically the School of Humanities and Social Sciences and the Child and Adolescent Development Program. We are so delighted to have you joining us this afternoon. We have quite a discussion lined up. We're going to be talking about mental health, such a serious issue today in light of COVID, while we are dealing with the physiological impacts of COVID. Certainly, mental health is just as pertinent a symptom, a side effect of the pandemic as the virus itself is. Today we have quite a number of individuals who are well versed in the area of mental health, and we look forward to hearing from them. But to begin, I'd like to welcome at this time Dr. Kenesha Nelson. She is the divisional head of social sciences within the faculty, Dr. Kenesha Nelson, and she will be bringing greetings. She will be welcoming you and sharing a few opening remarks. Kenesha.
Thank you, Craig. Thank you, everyone, for joining us. Good afternoon, everyone. It is my pleasure to welcome our participants and audience to this World Mental Health Day event on behalf of the Social Sciences Division in the School of Humanities and Social Sciences, which is located in the Faculty of Education and Liberal Studies here at UTech Jamaica. Every year, World Mental Health Day is celebrated on October 10. However, this year, October 10 falls on a Sunday, and therefore we decided to host the event today. The main objective of World Mental Health Day is to raise awareness about mental health and also mobilize efforts to increase support for persons with mental health challenges. The event is being hosted under the theme, Mental Health in an Unequal World, which emphasizes the need to ensure we make mental health care a reality for all persons. Equal access to mental health care means having access to quality mental health services and enabling more inclusive and affordable psychosocial support for all people. Celebrating World Mental Health Day gives us an opportunity to examine the state of mental health care in our country, to look at the progress that have been made to address mental health issues and what more we need to do to fill gaps that exist. Examining these issues are even more important in light of the COVID-19 pandemic. Going through this pandemic has had a major impact on people's mental health, and we must consider how we can scale up mental health services and interventions to address the residual effects of the pandemic. Generally, we have made some progress as a country, and there are initiatives that are important steps in the right direction. However, there is much more that needs to be done. We still have a problem with misconceptions about mental health, which strengthens the stigma around mental health issues. It prevents persons from recognizing and acknowledging when they have a problem, and it prevents them from seeking help. Stigma and discrimination experienced by people with mental health challenges affect their quality of life, including their educational and occupational opportunities. These are inequalities that need to be addressed as we promote the well-being of our population. Individuals, more than ever, need to be empowered to take care of their mental health and feel that they can do something to make changes to improve their well-being. We also need to be more aware of how we can help and support others who are going through emotional or psychological challenges. So the Social Sciences Division at UTech Jamaica wants to make our contribution by providing an opportunity and the space for these discussions to take place. so persons can be informed about mental health issues, services that are available to them, and what they can do to improve their well-being. We're happy to have with us today our guest speaker, Dr. Renato Oliveira Isoza, who is the Unit Chief for Mental Health and Substance Abuse at PAHO headquarters in Washington, D.C. We have also assembled an eminent panel of stakeholders to engage with us on the theme. We will also have a youth and mental health wrap session for young persons who are often left out of the conversations on mental health. If we are going to change some of the misconceptions and stigma around mental health, I believe we must start with our young people. Speaking of the involvement of young people, let me extend gratitude to Mrs. Tarine Davis, the Program Director for the Child and Adolescent Program in the College of Health Sciences, for collaborating with us on this event. I have no doubt that the discussions will be informative and enlightening. Again, welcome, and please enjoy the program.
Okay, thank you so much, Dr. Nelson. As you've quite aptly outlined, we have quite an esteemed panel and guest presenter, and we are really looking forward to our discussion. And mental health is a serious issue. To highlight that fact, we are so pleased today to also welcome, to bring greetings from the university, underscoring our understanding that mental health is important, is Professor Shermaine Barrett, Dean of the Faculty of Education and Liberal Studies. Professor Barrett.
Thank you, Mr. McNally, and good afternoon to all the persons on the platform. A very good afternoon to our specially invited guests. And it is first of all my pleasure to say welcome, or to join in saying welcome to all of you who have accepted our invitation to participate in this forum in one way or the other. We want to give a special welcome to our guest speaker, Dr. Renato Oliveira A. Sousa. And I hope I didn't massacre your name too much, but I still would like to say thank you for accepting our invitation to come. And what it does for me is that it demonstrates to us that you see the importance of this topic and this area at this level, to engage students and academia in the discussion. And that for me is appreciated and highly respected and honored. I would like to also say congratulations to the Social Sciences Division of the School of Humanities and Social Sciences within the Faculty of Education and Liberal Studies here at UTech for joining with the Child and Development Program to stage or to host this forum here today under the theme, Mental Health in an Unequal World. Ladies and gentlemen, as we consider this topic, it is important to note that the COVID-19 pandemic has revealed a myriad of inequalities within societies, and Jamaica is no different. There's economic inequality, which allows some persons to be able to afford help to help their students academically while they are out of work. They're at work. There are some persons who are not able to afford that and must juggle work, home, schooling their children, and all of those kinds of things. There's inequality in how we are able to access education. And there is nothing that pressures the mind that can be seen outside of mental health. And so I think this is a very, very timely, appropriate theme for the discussion around mental health within the context of COVID and the the various inequalities that has been exposed. And so on the last week, Thursday, the Faculty of Education and Liberal Study hosted a webinar for its first and second year students, with the plan to do that for third and fourth year students, focusing on their mental health. And it's amazing to hear the feedback from the students, how valuable this session was. Against that background then, I believe that it is such an opportune time for the school, and in particular the unit, to be engaging in this kind of discourse within our context. So we could have allowed Mental Health Day to pass, but we did not. And so I appreciate that. I congratulate those involved in the planning, and I wish for you a successful event today. Welcome again.
Absolutely. Thank you very much, Professor Barrett. Indeed, the faculty and the university, the wider university community, we are very concerned about our students, and we recognize that at this time, the mental health of our students needs to be brought into focus. And, you know, as Dr. Nelson said in her opening remarks, as a nation, we need to consider mental health and see how we can improve mental health, especially as it relates to access and knowledge about various mental health issues in Jamaica. Our theme today, again, is mental health in an unequal world. And, you know, just how you pointed out, Professor Barrett, that COVID-19 has indeed highlighted many inequalities in our world and indeed in our country. And mental health is one of those issues that we cannot afford to remain one that is only accessible to certain people. We have to level the field as it relates to that issue. Well, when you hear mental health, when you hear that term, what comes to your mind? At this time, we are going to be sharing the views of a few people who answered that question. When you hear the words mental health, what comes to your mind?
Get things that I even hear is getting me in trouble.
What comes to mind is if it's a state of mind where it's either good or bad, and
So when you hear the word mental health, what comes to your mind? Listen, guys, the chat is open. Feel free to jot down your ideas. What comes to your mind when you hear mental health? We do have our very special guest speaker, who is in the person of Dr. Renato Oliveira Esouza. Please allow me to introduce him, to say a few words about him. Dr. Oliveira is from Brazil and is the Unit Chief Mental Health and Substance Use within the Department of Non-Communicable Diseases and Mental Health at PAHO's headquarters in Washington, D.C. And his work guides the organization's mental health and substance use efforts throughout the Americas. Dr. Oliveira has worked in several capacities, including as mental health and psychosocial support advisor and specialist at PAHO headquarters, among other locations. He has also worked in the capacity of a psychiatrist. Dr. Oliveira has a Doctor of Medicine from the Pontificia, uh, uh, this is not in English, Universidad. Oh boy, this is not in English, folks. Yeah, in St. Paul, and he received his specialization degree in psychiatry from the Universidade de Sao Paulo. I'm sure I'm butchering this, guys. Please forgive me. He also has a postgraduate diploma in psychiatry from King's College London, and a Master of Science in Epidemiology from London School of Hygiene and Tropical Medicine. Sometimes it doesn't matter how much you practice, we still need more practice. Dr. Oliveira, welcome. We look forward to hearing from you.
Thank you very much. It's a pleasure to be with all of you here, and don't worry, you're doing great in your Portuguese language. So congratulations for that. Thank you very much, Professor Charmaine Barrett and Professor Kenisha Nelson for this invitation. So I hope I can share a bit of information that we have in terms of what is the mental health status of our population in the Americas region. Let me try to share my slide here. Okay, I guess you can see full screen my slide, right?
Yes, we can.
Okay, perfect. Okay, great. So yeah, let me share a bit with you, as I said, the knowledge and information that we have in relation to the mental health status of the whole population of the Americas, especially in what concerns the COVID pandemic. Well, I think it's important that we start by saying that even before the pandemic, the region of the Americas had a very high burden of mental health conditions. We know that 1/3 of the whole discapacity in the region is due to mental neurological substance use disorders and also suicide. We also know by the compilation of research done in many countries in our region also that the prevalence of common mental disorders like depression and anxiety were already very high, and if not one of the highest in the world, and here in the region of the Americas. Despite that, we know that in fact only around 2% of the total health budget in the region goes to mental health care. So this means that on average, a country in our region would spend 2% of the health budget on mental health. And remember that I mentioned to you the 1/3 of the disability in the region is because of the conditions that we are talking about here today. On top of that, on top of this small proportion of financial investment that goes to mental health, the reality is that in our region also, the majority of those funds go mainly to psychiatric hospitals. 60% is allocated to psychiatric hospitals. And we know that the psychiatric hospital is not the only, neither the best way to address the mental health of the whole population. Most of the time, psychiatric hospitals are in capital cities, they are far from the community. And also, unfortunately, many of the psychiatric hospitals in our region are old psychiatric hospitals where people are living there for many years without the adequate mental health care and provisions for recovery, rehabilitation at the community level. Our region also has a median number of mental health workers that it's across 10.3 per 100,000 population. Of course, countries that have more resources have more specialists. Countries that have less resources have less specialists. But we know that in general, the number of specialists tends to be very insufficient. And the figure that you can see here on the screen shows that countries that have the highest burden of mental health conditions are usually the ones that are in fact investing less in mental health. So again, this is in contrast to the needs. We see a lot of needs, and we see availability of care that is most of the time insufficient. It's important that I mention to you that 30 years ago, ministries of health of the many countries in our region came together and signed a declaration. And this declaration, which is called the Caracas Declaration, because it was signed in the capital of Venezuela, advocated for the importance of mental health care being at the community level, the importance of deinstitutionalizing people from long-term psychiatric institutions. And this declaration was mainly highlighting the problems that we had by that time and what was the way to move forward. And we are 30 years from that declaration. And in fact, there is still a lot that needs to be built up. What we have here now is some data that we have put together during the COVID pandemic. So there are many studies in our region, studies done in different countries, that show very high levels of distress, of high levels of symptoms of anxiety, high level of symptoms of depression, which I think it's not new. It's what we expected. As we go through this pandemic, we are all affected one way or another. So the studies, they corroborate what we are seeing, and what we are seeing many times inside our house, with our family, with our neighbors. So many people facing very high levels of distress. There are some population groups that we show that are more vulnerable, that have even higher levels of distress. So we know that there are studies showing that migrants, people with pre-existing mental health conditions, so people who already had a mental disorder, so they have a higher probability now of having a new episode or having a new crisis. We know that young people are very affected with all the changes that the pandemic brought to us. I'm not going to be extending much. There are many different ways of seeing how the pandemic affects mental health. We know that increases the probability of having a mental disorder. We also know that access to care has been very difficult for people with mental disorders in the current situation. There is a specific group that we know that it's also very vulnerable, which are the frontline workers, the health professionals who are there in the hospitals, in the primary healthcare facilities, being exposed to COVID infection, many times separated from their family members, in many places also with insufficient equipment to face the risks that the pandemic brings, and the long working hours, and many times also the lack of access to mental health support while they are working under extremely stressful situations. So health professionals, it's really a group who is a vulnerable one. We have been collaborating with University of Columbia and the University of Chile on a study called HEROES, which really tries to understand what is the impact of the mental health of health professionals. And we are even suicide ideation has been demonstrated to be increasing in this specific group. Again, we have a figure here that it's a big survey done in many countries by the World Economic Forum, and in fact, people were asked how was their mental health, how is their mental health now if you compare with how it was previous to the pandemic, and you can see that a big proportion, red and orange, are saying that their mental health has worsened when they compare to how it was previous to the pandemic. So just to recapitulate up to now, so we were talking about an important burden before the pandemic. Then we moved to describe briefly to you the impact of the pandemic on the mental health of the population of the Americas. And now I'm going to finalize this by saying that Here you have the levels of disruption of different essential services during the pandemic. This is a questionnaire that we at the Pan American Health Organization, together with the World Health Organization, we sent to focal points in the countries here, the 35 countries in the Americas. And the questionnaire was with the objective of trying to understand, so how are health services functioning nowadays? And as you can see, different types of health services were included in the questionnaire. And the fact is that when we put the data together, and this is very recent, this is around 2 months ago, we had also done a very similar survey last year. The results show that, in fact, 60% of the countries described that the mental health services were disrupted. So it's the highest level of disruption of health services during the pandemic, according to our survey. So you can see even more disrupted that the services for communicable diseases and also immunization services. So what we learn from here is that in a moment that people need the most, in fact, the services are very much disrupted. And this disruption is due to many reasons. And I'm sure each country has a particular situation, but most of the time is mental health services were closed, or people could not have access. We've heard that professionals who were working in mental health services, they were shifted to other services, mainly linked to the emergency and the pandemic, but then mental health services do not function anymore. So that's the reality that we have, and inside those services that I'm describing to you now, you have like suicide prevention services. We have emergency services for people with mental health in crisis. Sometimes also services for people on treatment of epilepsy, withdrawal of substances. So some of those services are in fact life-saving, but the reality is that there are many who are not functioning nowadays. What I also wanted to mention to you that this is not the only stressor that the population of the Americas is facing these days. So yes, the pandemic is a major stressor. It has changed life for everyone, but our region also faces very high levels of violence, and we have the highest levels of homicide in the whole region, in the planet, if you compare with other regions in the world. And we are also being affected by the changes due to climate change, which we know also have and will have an impact on the mental health of populations. So it's different stressors deteriorating the mental health status of the population of the Americas. So that's why this topic it's very important, and I really thank you all for taking this opportunity to commemorate the World Mental Health Day. That's one of the main opportunities during the year that really advocate for mental health care for all. Well, with all this that the Americas is going on, in fact, the UN at the beginning of the pandemic prioritized mental health in the response and advised countries that mental health should be one of the pillars of the emergency response of COVID-19. And some recommendations also came from the executive board of the World Health Organization, which, as far as I know, it's one of the first times that countries really came and openly spoke about the importance of mental health. So many countries described how the mental health situation was in their own countries and what they were trying to do to overcome the challenges and barriers brought by the pandemic. But in general, at the end of the executive board of the World Health Organization, key recommendations were put forward, which have been guiding us at the Pan American Health Organization on how we support countries, but it has been also guiding countries themselves on how they integrate mental health and psychosocial support into the emergency response. The first point of importance is that we are not anymore thinking about mental health and one specialty, or we health professionals or mental health professionals are the ones that have to be responsible and take care of it. Today, due to the impact of the pandemic and the other stresses that I have mentioned to you, we need to see mental health as a whole of society approach. So everyone, every department in the government needs to have mental health in whatever they are proposing for the well-being of the population. So education can have a key role on mental health. Social security can have a key role, labor. So different departments need to incorporate a mental health perspective. I'm not only talking about care. Usually care, diagnosis and treatment is inside health. But when we think about promotion of mental health, protection of mental health, each and every department has a role to play. It's fundamental that in the response that the countries are putting in place, all countries are putting a response in place, public health measures, many times social support to people in situations of vulnerability, scaling up medical care, primary health care and hospital facilities. But again, mental health needs to be an integral component of that response. And last but not least, the third important point in this framework is that we take this as an opportunity. So this probably has never happened before. Like people, everyone thinking about mental health, everyone concerned about mental health. So we need to take this opportunity to strengthen mental health care at the country level, to build up better mental health systems, and to look into the future. And as we embark on universal health coverage, that mental health is a fundamental, an essential element of universal health coverage for everyone. We at the Pan American Health Organization have been doing quite a lot of work since the pandemic started. So on our side, we have integrated mental health into the key pillars of the response of the organizations when the organization supports countries with technical cooperation. So that was the first thing, to make sure that we are part of the emergency team and that we are an essential team member in the response inside the organization. We have been developing many courses and we have been in very close contact with countries. We developed courses on coordination mechanisms on mental health and psychosocial support. So helping countries to develop multi-sectoral capacity at the ministerial level in a way that the response is coordinated among the different actors on the ground. We have also created courses and capacity building on strengthening mental health service delivery. Many countries have created hotlines or remote interventions. So we have also been providing support, capacity building, sharing experiences among countries. A lot of capacity building, as I mentioned, has been ongoing. We have provided a lot of training on psychological first aid, which is how a person how we receive and support a person in high levels of distress and refer to the adequate mechanisms when necessary. But we also have done a lot of training and capacity building on MHGAP, which is a WHO guidelines on the integration of mental health into primary health care. And we have also developed a lot of communication materials. So countries could use the communication material that we developed to develop their own communication material and inform people about the importance of mental health and how to protect one's mental health. So all this is available in the PAHO webpage. We have specific section on mental health, on mental health and COVID-19, on mental health and psychosocial support and emergencies. So all this material is available for free there. There are infographics, there are videos helping people to take care of themselves, how to recover from grief. So everything is available there. And before I finalize, I wanted to share with you what we really believe it's not only the future, but it's in fact it's the present. If we want to be able to make mental health care available for all, if we want to make mental health available as close as possible to where people live, we really need to think about this multi-sectoral approach and what we call the whole of society approach. We have learned a lot in terms of using new technologies, and I think this is a way. Of course, there are also limitations, but this is another opportunity that we have to reach people that probably could not reach mental health services before. So we need to capitalize on that, and we need to put a specific focus on vulnerable people, or people who are in vulnerable situations, people who usually have higher levels of mental health conditions or do not have access to care. I mentioned to you the importance of integrating mental health into everything that we do in this response to the emergency. And the most important point, which is in fact, we need to put adequate funding on mental health. The same survey that I mentioned to you a few minutes ago, that we sent the questionnaire to the countries and asked what was the state of mental health services at the moment, there was also very positive news coming from the countries. Like, the majority of the countries described that mental health was part of their response to the emergency, that they were establishing coordination mechanisms, but only a small proportion of countries described that there were specific funds allocated to that mental health and psychosocial support response. So if we want to advance with mental health, if we want to make it accessible, we need to increase funding. Otherwise, we are not going to be able to train human resources to strengthen the capacities that already exist, to make services accessible, especially primary health care, where it is closest to the people that need it. So all this needs more prioritization in terms of funding. Thank you very much for your attention, and again, happy World Mental Health Day.
Thank you so much, Doctor. Thank you so much, Dr. Oliveira. You shared so much. I mean, I was making copious notes as you spoke, and I'm going to be highlighting a few of the things that you mentioned in your presentation. But I just like to say a special welcome, firstly, to all the persons who are just joining us. We're now up to 140 participants. Welcome to all of you. We are so excited that you have decided to join us this afternoon to discuss such an important topic, that of mental health. Our theme today is mental health in an unequal world. And Dr. Oliveira's presentation certainly highlighted that right now in the world is a very unequal place, and particularly when it comes to the issue of mental health. Dr. Oliveira, I also have to take my hat metaphorically off to you and the team at PAHO, because clearly this is a very important matter, and you have been doing a lot of work to ensure that the necessary resources that are needed across the world, especially in the Americas, are available. And I was kind of wondering if you have the links to any of these resources. Perhaps you could post them in the chat for persons who would like to see them. So if that is possible and not too much trouble, or if you could give us a website that we can go to see all these resources, that would just be great. If you do have any questions based on Dr. Oliveira's presentation, you are welcome to post those in the chat. And not only on his presentation, but as we go through this afternoon, if you would like to chime in, please, you are more than welcome to post those comments in the chat. In Dr. Oliveira's presentation, he mentioned that more specialists are needed. He also highlighted a correlation between a lack of mental health resources and an increase in mental health issues. And he highlighted that frontline workers, and these are my words, are doubly vulnerable. They are a doubly vulnerable population because not only are they required to treat persons who present with COVID symptoms, but their own mental health, and of course by treating persons who are impacted by COVID, they are putting their own health at risk. And then there are the invisible symptoms, so to speak, of mental health, which also impact them. And in Dr. Oliveira's presentation, he also mentioned a disruption of services. I was very delighted to see him highlight telehealth as one of the initiatives that PAHO is trying to push in the Americas. And he also mentioned what I am calling a despecialization of mental health. In other words, when it comes to the promotion of mental health, it shouldn't just be seen as something that the clinicians do or the mental health professionals do, but it is a job, it is a task, a service for really everyone, and especially for us here at UTech. The fact that we are doing this forum today is an indication that we understand that mandate. Now, earlier, we attempted to share a Vox Pop with you, but we had some challenges, and that Vox Pop surrounded the question, when you hear the word mental health, what comes to mind? So what we're going to do now is to show that presentation, that Vox Pop again. Well, and we have another Vox Pop, and the question for that Vox Pop, which will follow unannounced, is when it comes to mental health, what is important to you? When it comes to mental health, what is important to you? And of course, if you have any questions, again, based on Dr. Oliveira's presentation, you're free to put them in the chat right now. And if you'd like to respond to any of those questions as well, you are welcome to do so. Let's see our Vox Pops.
What comes to mind is basically where it's either good or bad, and if it's affected, it can affect the person in very bad ways.
I believe
What comes to mind is basically if it's a state of mind where it's either good or bad, and if it's affected, it can affect the person in very bad ways or good ways.
Well, to me, I believe in positivity. I believe in whatever you have to say, you just say it at that particular time because I'm an honest person.
What comes to mind is basically it's a state of mind where it's either good or bad, and if it's affected, it can affect the person in very bad ways.
First thing that comes to mind is my mental challenges that will I handle it. Especially during this COVID,
Right.
how am I able to cope with it? So you have
if you are most importantly seeking help.
is that I am to help somebody else, because if I'm not well, if I'm broken, I can't help anybody. Well-being.
All right, so we are hearing our respondents. Yeah, we're hearing our respondents say mental health is well, it can either be good or bad. That's what I'm hearing them say, and I'm also hearing them talk about being aware of being mindful of knowing when you're not doing well and to seek out the help that you may need, seeking support. Let me just look quickly in the chat. Can we see what persons have posted in the chat in response to that question? Thank you so much, Ian, for sharing this information with us, which would be an addendum to Dr. Oliveira's presentation. Thank you, and thank you for the work that PAHO and the WHO has been doing. What we're going to be doing now, and remember the chat is there, guys. Feel free to share your comments. And thank you, Dr. Oliveira, for sharing the links as asked. You have shared the links to a number of COVID mental health resources, and I trust that we will definitely find those very useful. Thank you. Thank you so much for doing that. Well, besides Dr. Oliveira, we have brought together quite an esteemed panel of mental health professionals this afternoon. And at this time, we're going to be inviting each of them to share their views, but I'd like to firstly introduce them. I'll do this as quickly as possible. Our first panelist is Dr. Kai Morgan. Dr. Morgan is a registered clinical psychologist in Jamaica with a doctorate in clinical psychology. She has worked as a clinical psychologist at the University of the West Indies, as a lecturer at the University Hospital of the West Indies for 15 years, and as a consultant in the Department of Community Health and Psychiatry. In 2016, she moved into the entrepreneurial world to include a private practice and consultancy work, business, and other business endeavors. Dr. Morgan's private practice includes a team of 8 other associate clinical psychologists, And the services include both therapy for trauma, depression, anxiety, personality disorder, and assessment. She is currently the president of the Jamaica Psychological Society, JAMPSych, the co-chair of the Professional Practice and Standards Committee of the Caribbean Alliance of National Psychological Associations, CAMPA, and she sits on the executive board of the Lister Mayor Gilby School for the Deaf, and is a member of the American Psychological Association's Global Psychology Alliance. Her interests for both research and clinical practice include trauma, sexual behavior, couples, relationship dynamics, and Caribbean psychology. Our other panelist is Janelle Brooks. Janelle is a rehabilitation and mental health counselor with 12 years experience in the field, a mental health advocate and lobbyist. She is passionate about building awareness on the importance of being mentally healthy and is keen to see greater improvement in the treatment, care, and support for the mentally ill. She was awarded the prestigious Fulbright Scholarship to pursue master's level studies in rehabilitation and mental health consulting at the University of South Florida. Her professional experience spans work in the areas of clinical therapy, counseling, behavior change, mental health, substance misuse, prevention and rehabilitation, homelessness, community development, HIV/AIDS, as well as working with at-risk groups, including youth. Janelle is passionate about working to promote positive behavior change in persons and gives of herself outside of work hours to several initiatives and groups, including the Jamaica Fulbright Alumni Association. Our other panelist is Dr. Ganesh Shetty. He is a naturalized Jamaican. He's a consultant psychiatrist who has been assisting students and staff at the counseling unit at the University of Technology, Jamaica since for the past 21 years. He's also the consultant child, adolescent, and adult psychiatrist at the KSA Health Department. He has worked at various child guidance clinics in the region, schools, and several volatile and vulnerable communities focusing on traumatized youth, parents, and teachers. Also, he has his private practice at Shekinah House. And I should also mention that after security operations in West Kingston in 2010, Dr. Shetty, along with his colleagues, has helped over 250 children who were from those affected communities impacted by post-traumatic stress disorder. Presently, in collaboration with NGOs, Dr. Shetty and his team has trained and is supervising the delivery of trauma treatment by youth workers in inner city communities of West Kingston, and has trained teachers of Augustown Primary School to assist traumatized children and parents. Our other panelist is Mrs. Diane Gordon Harrison. Mrs. Gordon Harrison has been the Children's Advocate of Jamaica since January 2012 and has been Jamaica's national rapporteur on trafficking in persons since March 2015, making her the first to hold such a post in the Latin America and Caribbean region. She is an attorney at law by profession who has practiced at the public bar since graduation from the Norman Manley Law School. Prior to her appointment as Children's Advocate, Mrs. Gordon Harrison served as a Deputy Director of Public Prosecutions. Known for her advocacy skills, she states that her current role provides a national as well as a regional platform from which to promote the rights of children and other people in vulnerable circumstances from a victim-centered and rights-based orientation. She's also passionate about accountability frameworks through which persons who violate the rights of children and vulnerable persons can be held responsible for their actions. Welcome to all of you. Welcome. It's so wonderful to have you. Your profiles certainly raises the bar of what we have here this afternoon. I'm sure coupled with Dr. Oliveira, we have the best team of experts lined up today. Welcome to all of you. Probably the first question I'd like to throw at you this afternoon is, how is mental health viewed in Jamaica? And of course, as our panelists get ready to answer that question, if you would like to chime in, you are free to post your responses in the chat. How is mental health viewed in Jamaica? Anyone?
Okay,
Okay, Dr. Morgan.
I'm up. Right. I've been dying to say this note because when I started the time the theme for this year's World Mental Health Day, what came to mind is what Donkey say, right?
Donkey said the world on a level.
Donkey say we're on a level, right? And what COVID has done is kind of show it up, right? But in showing it up also, it has really allowed persons who really didn't recognize, so on the kind of goodish end, realize the importance of mental health. It has kind of moved it up a little bit more, up into the forefront, more than it was before. We have a lot of ways to go. We have a whole heap of ways to go, but it has definitely moved it in that way. So I think that that is some of the shift that I've been seeing over the last year and a half in how we view mental health, that there's just more, it's a little bit more on everybody's tongues, right? How does that now translate into services and resources and all of that is a whole different story, but it is definitely more on everybody's tongues.
Right, absolutely. And we would have seen in Dr. Oliveira's presentation, he highlighted the need for more funding. Hopefully we are now seeing that we do need to pump more money into mental health. Dr. Shetty, I see your mic is open. Would you like to chime in on that question? How is mental illness viewed in Jamaica?
We have hopefully moved beyond the mental health problems, beyond the mad, bad, and head no good stage. And we hopefully are not going to obey a man and heal a man when somebody has mental illness. However, there's so many subtle illnesses which are more common than schizophrenia and bipolar disorder, which are usually in their extreme form and hit the Hollywood too. We have to really focus on other subtle disorders which are affecting a lot of folks, especially now with COVID and cutting off of social life and being in a self-imposed home arrest, anxiety, depression, and such, as well as post-traumatic stress, especially those who have lost their loved ones, is important. And as the Dr. Oliver was saying, we don't and will never have enough specialists. So we have to train everybody who can be trained to do everything they can do to help everybody in their sphere of influence. That means teachers, parents, lecturers, professors, anybody who could be trained to help anybody they can help. Thank you.
Right, absolutely. He certainly indicated PFA, psychological first aid, which really is an intervention that everyone, all of us, are able to offer. To be a first responder to somebody who is in need of support. So Janelle, you lobby on the for the issue of mental health. Have you seen any changes in how mental health is viewed in Jamaica? As a lobbyist, what is it that how is it that you would like mental health to be viewed in Jamaica?
Thank you. So I believe, like Dr. Morgan has said, that we have come some way. I will still have a ways to go, but definitely the conversation is increasing. With World Mental Health Day being observed yesterday, just looking on social media, you can see people were being more vocal and sharing their personal stories and, just posting about the day, which 5 years ago, many persons didn't know that such a day existed. So we have made some improvement. So I think now we're at the stage, as the theme would suggest, where everybody is aware or more aware than before. So can we now do something to improve and increase access?
So what that would look like for me, some examples would be comprehensive coverage by health insurance companies, more corporate companies offering employee assistance programs, what we know as EAPs, more psychologists and psychiatrists in the public health system, and also more of the teachers and persons in the school system having that psychological first aid training.
Right, absolutely. I'd love to bring in Mrs. Gordon Harrison at this point. And Mrs. Gordon Harrison, we're talking about mental health in an unequal world. When it comes to children, do we really give, in your experience, have you seen where we are giving the mental health of children the kind of attention and priority that it needs? And I'm sure Dr. Shetty would also love to chime in on this once you have commented.
All right, so thanks for having me. So from my perspective, the treatment of mental health and children really falls within the same ambit as the treatment of mental health generally. And so what we find is that persons sometimes emphasize the physical aspect of the well-being of the child, but we fail to understand the power of external stressors and the impact that they can have on children's lives. And so sometimes we do not recognize the issue early enough for meaningful interventions to be made. These issues then fester and become more problematic as the child gets older or as the external stressor that's in the child's environment persists. And so while we have made very significant strides, I would say, in the aspect of how we consider mental health as being a part of general health and wellness and safeguarding children's best interests, we still have a long way to go. There are very capable persons in the field. For example, you mentioned Dr. Shetty may want to chime in, and I'm sure that he will. And he and I certainly have had very many conversations and cases that we've had to work on together. So we have qualified individuals, both in the public and the private sector. But what we have is a paucity of dedicated resources. When you look at the global figures, for example, you're seeing that the proportion typically of budgets that are awarded within the health sector to mental health is a mere 2%. So that tells us that we have a long way to go, and we need to recognize that small stressors can pose very big problems with children, and that's what we continue to see.
Awesome, thank you. Thank you so much. Dr. Shetty, would you like to add to that?
Sure, if I can share my screen, it will help people to understand my accent, which is neither Indian or Jamaican at this point. I think we miserably fail our young people when it comes to giving them the support and treatment for their mental health issues. Recent Capri study showed that only 8% of children with mental disorders in Jamaica get help. And when it comes to child guidance clinic, which is basically government mental health clinics for children and adolescents, we see about 5% or less. We have about 160,000 children who have a mental health issue, and 40,000 of them have a serious mental illness. And we see about 5,000 of the total 160,000. So rest of them, what happens to them, where they go for help, what is the outcome? We have no big studies to prove that, but I should imagine it must be suboptimal to very bleak. We have to look at the systemic issue which fuel the mental health problems. We are in a monitor system where everything is for sale and everything is commodified. And we have an education system which tells a lie that you're only as good as your grades and your future is only as bright as your grades, stresses young people long boring classes and kills the creativity and make them succumb to the job slavery. And we have a social system which entices them to get stressed out and then get addicted to feel good, whether it's alcohol or social media or video games. And media has become a social propaganda apparatus of false news. And we don't learn how relationships are controlled by life schemas. And many folks, young people who should not have children, and you can imagine what will happen to unwanted kids. And we have a military system. JDF has a military, and Dons in the inner city have their own military, and there's constant fight between them. And we have a missionary system, not so much here, where religion used to broker power and cause mayhem. And we live in a materialistic system which says what you possess is more important. Who you are, what you drive is more important than what drives you. What is on you is more important than what is in you. So what has happened? This system, in conjunction with poor parenting skills, poor psychosocial support, adverse childhood experience and trauma, and unidentified and untreated mental disorders, has led to so many problems in the society, and the bridge of life is broken. And we in the mental health services trying very hard to pull the young people who fell into the sea of depression, drugs, and so on. But I think we should also focus on building the bridge of life. Thank you.
I love that. Building the bridge of life, or building a bridge of life. We need plenty bridges. We need many, many bridges. And then so, you know, in line with that, I'd probably want to ask Dr. Morgan, let's say we were in a utopia, a mental health utopia. Everything is, what would the perfect mental health, what would a mental health utopia look like to you? What would the services be? How would it work? You know, what would that look like?
Right. Right. I think actually, Jenny,
in counseling, we call it the magic question. So if you could snap your
wake
finger.
up tomorrow morning. Yeah, definitely. I think actually Janine started to talk about those kinds of things, because it's the overall access to care. And that would mean that from a national perspective, there is that respect for that right to mental health for everybody, which means then that not only public sector, but the private sector would have to be included in that. So we're talking about, I get up tomorrow morning and I feel like, listen, I feel I'm not feeling so great and I need somebody to talk to and I need some support, that I can easily pick up the phone and find someone, right? Easily, right? So I can find someone easily. I can call a line maybe, or I can jump on a website and I can find somebody and I can actually afford to, because maybe my insurance covers it, or maybe my EAP program covers it, and or something along those lines, right? That I'm able to get that kind of accessibility, I think is really important in that utopia. So it's something that, again, we'd have to come together to be able to offer, because we have the services in the different sectors, but one, you're gonna have a long wait for one, right? And the other one is too expensive. So it's like, what do we do? So that's my utopia, that you get up and anytime you feel like you need some support in addressing those mental health issues, or a day, these smaller issues that two of our panelists have talked about already, the smaller things that do become big things for people, you can address them.
Right. I saw someone comment earlier. They said that mental health is sometimes seen as an excuse, that, it is felt by some that mental illness or having some other psycho-emotional issue is viewed as a excuse. That brings us to a point that I kind of want to bring up, which is about So a part of that utopia is that not only do we have access to the services, and not only are the services available, but I think the mindset of people also needs to change. So then,
right,
if I have access to the services and I go and I report back and say, hey, I went to see a professional, I went to talk to somebody about this issue, and they think probably I should take a few days off, it's not going to be scoffed at. or
Right,
you
right.
seen as making an excuse for not wanting to do something or not do
Right.
something.
Absolutely. So
So
then as to me wanting to, in that utopia, access those services, have access to those services, then I'm not stigmatized for it or judged or,
exactly.
yes.
Exactly, exactly. Are there, and this is to anyone on the panel, are there some groups that are stigmatized when it comes to the issue of mental health?
If I could jump in, not being a clinician, but from the legal perspective,
Sure.
the short answer to that question is yes. But I was thinking it was a good time to jump in because listening to Kai's description of utopia, it sounds like the utopia that we have been trying to create for children. So very recently, because of all of the external stressors that the COVID-19 pandemic has unleashed on children, the Office of the Children's Advocate, in partnership with UNICEF and the private sector organization, has in fact launched Safe Spot, which is a 24-hour helpline for children that offers them access 7 days per week, whenever they feel like talking about whatever little thing or big thing it may be. And what it does is it eliminates that gap that has long existed, which is the delay in getting help directly to that child. So a child can now call toll-free, Dr. Morgan, so you can afford it. And when they call toll-free, they're immediately connected with qualified psychologists and counselors who provide that remote access on whatever issue it is that they need. And so I think it's very important that this is not a silver bullet, but it certainly is, I think, an example of the interventions that we need to create that are immediate, effective, confidential, and services that relate to our target populations in the way they want to relate to us. So for example, Safe Spot, you can call it without credit from either Digicel or Flow. And very importantly, you can in fact provide support to children via WhatsApp, Instagram, and Snapchat. So we accommodate them sending us a direct message, and our counselors are trained that if this is the way the child has reached out to you at whatever time of day it is, this is the way that the mental health and general emotional support is to be provided. So I think that sounds a little bit like utopia, okay?
It certainly does. It's definitely a lot of steps in the right direction. I remember years ago when we had the Friends hotline, and right. Well, that was my gingeration, as we say in Jamaica. That's my gingeration right there. Right. Awesome. 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 I. But are children among the stigmatized groups when it comes to mental health? Do we take, and I think I saw somebody post this in the chat actually, do we take what children say about their feelings and what they're thinking about? Do we take these things seriously, and what can parents do to what should parents know about about the mental health of their child or children?
I think first of all, the parents need to learn what is the better way of parenting them. So mental health remains steady and mental illness has little chance to peep in. That means not to use physical punishment as a way of discipline, not to ignore the child's ability to express, like shut up, you don't know nothing, should not be there. Children should be seen and heard and cuddled and nurtured. And the children should have a time with the parent. In fact, one research shows every child needs 20 minutes per parent per day. Not talking about homework, just sitting and chatting about the day. So family dinners could help a lot in that aspect. And anytime child is distressed, whether it's school because of bullying or not doing well in tests, they should feel free to come and talk to the parent or teacher for that matter, so that they have a way to vent, and that will support their mental health more than just having these tests and all these marks and grades and extra classes and extra discipline if they don't do well in PEP exam or GSAT used to be. So I think it should start from home. right? And there is a lot of effort done in that direction. For example, there's a National Parenting Support Commission, which is doing a lot of parenting training. And also now Ministry of Health in collaboration with Ministry of Education, bringing in something called a mental health curriculum in schools, so that the key persons in the school will understand what is mental health, more importantly, what are the signs of mental illness, so they can identify and do the necessary referral, whether it's to guidance counselor in the school or challenges in mental health clinics or child guidance clinics as such.
Okay, thank you very much, Dr. Shetty. So, Ms. Brooks, would you say that mental health, I'm going to use the word therapy. Is therapy just for the privileged? There seems to be, I think I saw someone posting in the chat something about mad people, mad. Are only certain people in Jamaica able to access mental health? And there seems to be an idea too that mental health and going to a therapist, going to talk to your shrink, is something that is okay, but only if you're from uptown. Have you heard that?
Surely, I've heard that before. So we do know, like we've outlined, that there are some barriers to access. Cost is one, right? But there is that perception. Some of it has changed, but I have heard that statement before about, counseling and therapy being for uptown people. And if you have to go to a psychiatrist or get medication, for example, that would mean that you are mad or crazy or you're chip lick or whatever we say these days, right? But for me, adding on to the answer about the utopian mental health society, that has always been a part of my utopian dream. Is, when I was in the States studying, it was such a different environment because everybody was like, oh, it's 12 o'clock, I have a therapist appointment, I'll be right back. And you just da-da-da-da-da and you go about your business. I wish that for us, it would be so, commonplace that, I can just be like, okay, I'm going to therapy, check you later. Because it's not just for uptown people, it's for everybody, So like I said in the beginning, I think we're making some waves in terms of people becoming more open. We're not fully there yet, but I know the millennials and whatever comes after that are more open to seeking mental health care and talking about their mental health issues. So I think we're going in the right direction.
Absolutely. In fact, many, I was going to say YouTubers, but really it's not just YouTubers. Many of our influencers on social media have been talking about their own mental health issues. And it's when they talk about those issues that we begin to hear other people chiming in and saying, well, yes, I sometimes feel this way. So they're really helping to normalize. If I could share a quick story, I remember I was at a restaurant in, I guess you could call it an uptown area, when one of my patients saw me and said, yo, he was with friends. I said, yo, I'm a therapist, I was like, we don't talk about that in public. No, man, it's all right, man, it's cool. And then offered to buy me a drink. But I really was surprised about how he wasn't afraid. I don't know if we were downtown, if we were in another place, if he would have been as open to say that, he goes to therapy. There's a question which was posted by Marilyn Face. Marilyn, thank you for this question. And I'm going to be asking our panelists to now become seers. So bring out the crystal ball, Mrs. Gordon Harrison. It's time. The question is, can we discuss what impact almost 2 years of online school may be having on high school and tertiary level students? These are the years for key friendships, networking, and independence versus social isolation.
Yes.
I don't know how you see us coming out of this.
Mhm.
How will we look come
Mhm.
2023?
Or
How will our children function? How will our young adults function? Will
or
employers want to employ people coming out of this period of time, this season?
right. I think that's a very good question. And I would perhaps project even farther away to say, how will we look in 2030? Because when you're talking about children who, and young people, not just children, but youth, who are supposed to be at this stage, not only dealing with the academic growth, but certainly in terms of their social ability to maneuver, to adjust, to interact, and really to develop relationships in a very meaningful way. And at the same time, hone their skills when you're talking about independence and so on. All of those opportunities, for the most part, are being retarded as we speak. And so, what it means is that if there isn't external support in the way of parents, perhaps, or groups or networks around these children who are largely in isolation and working online, it means that we could very well have dysfunctional children now who will morph into dysfunctional adults and young people. And so it's very concerning because what it means is that we could feel the impact of the COVID-19 pandemic and all of the quarantining and self-isolation measures that we've had to take on because of the public health concern for a very long time to come. How effectively will our young people be able to function within a working environment? How much will they be able to develop and rely on their own initiative and their discretion when these things are being hampered in a very meaningful way? So I think any mental health interventions or support that we look at, we have to look at kind of making them more bespoke to this very significant and different period that we've had to be living through, because it is a real challenge, which I think could hamper us for a very long time in the outcomes for years to come.
Right. Thank you. Thank you so much. I think you're on spot with that one. You're definitely on spot. But I think if we can see that that is a possible future, then we can begin to put the kind of support systems. You mentioned Safe Spot. Someone was asking if you could provide the number for Safe Spot. So
Certainly.
kindly, if you could post that in the chat, we'd be really appreciative.
If I could be allowed to share my screen for just a little bit, would that help?
Oh, sure. Oh, absolutely.
Right, actually.
Go right ahead.
Yes, thank you. There it is. I hope you can see that.
Would you, oh, is that in Word?
No, it's in PowerPoint.
Oh, it's PowerPoint. Okay, could you go full screen?
Okay.
Go to slideshow.
Okay. There you go.
Okay, awesome. So the number is 888-723-3776. And of course, there's a WhatsApp, and there is that could be, I think, Instagram.
Right, Instagram and Snapchat.
Instagram handle.
In the DM to our
SafeSpot
at SafeSpot.ja.
Awesome. Thank you so much. Thank you so much for sharing that. So this is probably a question for you as well, Mrs. Gordon Harrison. Is there more of a need for legislation around mental health, and specifically for children and adolescents? What kind of legislation do we need in terms of mental health?
I don't know if I would say legislation. I would more lean in the realm of policy. So already we have the framework that says that children ought to access all the support with various things, whether it be education, health, and otherwise. But what we need to look at are the policy imperatives that we have and the way in which budgetary support is given to the mechanisms that already exist. As I mentioned earlier, we have, for example, the Child Guidance Clinic, which continues to give human service through the persons who are employed to provide that support to children all across the sector. But when you look at the number of cases that each psychologist has, the case to psychologist ratio is insane. Let's put it in very plain terms. And when you're talking about accessibility, you have to think about affordability. So the Child Guidance Clinic exists as a great model, but it is starved in terms of human and financial resources. So how about beefing up and redistributing the resources that we have dedicated to child mental health systems that already exist? So that's more a policy imperative than legislation. Also, if you think about initiatives such as SafeSpot, we need cash to care as well to kind of help bridge the gap with that. I want to talk to somebody at 2 o'clock in the morning, but I don't want to do a voice call. I want to do a WhatsApp. It does take cash to sustain these initiatives. So I think if we look holistically at how we can, apportion budgets to give legs and real meaning to interventions that exist, that will put us farther along the curve than if we look, more at legislation. Because legislation without more is great, documentation on paper, but not giving meaningful life to the services that need to be sustained to make that great impact.
Awesome. Thank you. Thank you for that clarification, Mrs. Gord Harrison. Dr. Morgan, you
Yes.
raised your hand.
Yes, I wanted to I wanted to add to what Dan was talking about in terms of policy, because we've been talking a lot about this at the Jamaican Psychological Society, and the two groups that I feel like we get a mass of persons that we can kind of impact are in the workplace and at school, right? And that bringing mental health from a very individual, family, subcultural kind of perspective is going to be really important, because we will never have enough mental health professionals to address all of the issues, right? All of the issues that are involved, and so that we are faced with. And so the importance of each person taking care of their mental health, and organizations and institutions also putting mental health to the forefront is really critical. So it should be just like you can pick up in this utopia, pick up the phone, or just say, to your colleague, "I'll soon be back. I gone to do my therapy session," right? You maybe could have a safe space in the workplace, right? You could have something at school where there's always relaxation techniques at the beginning of every day. There is, I remember a school that was doing some yoga, and some reports on that school every day, and they saw reduction in aggression and fighting and some behavioral problems and all of that. So these are the things that I think should be like endemic to these big groups. We're gonna catch a big chunk of the population if policies are instituted there. So we have been talking about and actually crafting, so whoever needs the help. So we liaising and trying to get that liaison with a school, we call it happy, right? So like a mental health or a workplace happiness policy, or whatever we want to call it, school happiness policy, where of these are the critical pieces that every individual recognizes, that is not only when I am feeling depressed or when I'm having a psychotic break, or, and all of this, that each individual has a mental health. We all have mental health at some point on the spectrum, and changes daily sometimes. So that's an important piece, I think, as well.
Right. I love that. Something that came to mind as you were talking. I love the name happiness policy. So maybe somebody might want to teeth it from you, but it certainly says what it is. It's about keeping us, not necessarily happy, but it's ensuring that everybody is doing okay, or at least as best as they can. I think for me, as I think about, how organizations, you can get a sick leave from work. People don't think about a sick leave as being for a mental health day. You know, it's more about, oh, well, you know, you broke your hand or your back hurt you, or you have, ongoing headaches or whatever, but not for, oh, you know, I'm feeling really down today, or, you know, I'm not feeling, whatever it is. But mental health certainly needs to be considered as a very pertinent part of needing to take needing to take a sick day as well. Dr. Shetty, I see you want to chime in on this.
Sorry,
Yeah,
quick.
Sorry, go ahead.
Sorry, before you jump in, Ganesh. So sorry.
Sure.
But I needed to say happiness is not me. There's actually, and you all should check it out. There's the country of Bhutan. I don't know if anybody's heard of Bhutan, but Bhutan actually uses a global happiness index instead of their GDP, right? And there's no GDP, and they use happiness, and these characteristics of wellness are built into that index for the country, right? From a national level. And there are other countries. I think New Zealand has something similar as well. They don't call it happiness, but it's a similar kind of thing. So it's not me, but but we're probably, trying to keep it from there.
Okay, I love that. I love that. Thanks. Dr. Shetty?
I want to just reiterate, echo what Mrs. Harrison said, that the disruption of social life has done damage to many young people's mental health. I see a lot of kids, a lot of students at UTech Medical Center. And what has happened is they've been moved away from their social milieu into their homes, where they're locked in for most of the time. And the amount of work they're supposed to do has not reduced. Deadlines are still very narrow and strict. And they get tired of looking at the screen for the whole day, and they want to chill out. And so they watch little YouTube and go on their social media. And those things are addictive. Actually, they're created with the help of neuroscientists and psychologists. And once they spend a lot of time, they get into a lot of anxiety to finish the assignment, which is due next day. And the addiction is so much that one of the 14-year-olds, when his father took off the Wi-Fi from the house, he took alcohol and threw it on his face, right? Because he was so upset. And other one tried to grab his mother's neck. So these video games and social media can be very addictive, and older folks are not any exceptions. And they will rob them of even little interaction they might have at their home with a sibling or mother and father, because they're cut off from their friends, they're addicted to the screen, and they have no time to talk to anybody else. So that is a really serious issue.
Right. I know that, and it's interesting how our discussion has slanted more towards children who are a very important population as we talk about mental health. But since we're talking about, the impact of COVID and the social isolation that it creates, I'd perhaps just like to throw in here that there are many people for whom, I call it as having a love-hate relationship with work. You have to go to work, but if you don't have to go to work one day, you're so happy you don't have to go into work. But for many people, work is a distraction. Work is a very needed distraction. And there are a lot of people now who have had to be working from home, or they work from home a couple of days of the week, and the other days they go into office. But for many people, being more at home has created a lot of challenges for them, because them now lock up in the house with the man where won't stop annoy them and who is abusive, and they don't have any space to think, they don't have any space for themselves, and so just the whole working from home issue in terms of an adult is something that definitely also needs some ventilating. But unfortunately, we can't do that today. We can't do that right now because we are out of time. We are certainly out of time. And so I'd really like to thank you, our panelists, for sharing. Are there any questions from our audience that you'd like do? Are there any questions? We can probably do two minutes or so of questions. I'm perhaps seeing more comments. For example, Chandrise, I think, is saying, look at this, but at the same time, when we say we want to take a break from the screen due to the pandemic as well, we can't go out to see our friends, even go out at all because of all the restrictions. Take the 7-day lockdown. The only thing I can do is use social media because that's how I can communicate to my friends, right? So, there's a negative and there's a positive. We have to keep everything in balance. Social media, there are some negatives, but it's what really helps, serves as a communication tool. There's a question, not seeing from who. Can we scroll down just a tad so I can see who that question is from? Right, we have a question from Rashana Jarrett. She asks, in this unequal world, what are some systems that can be put in place by organizations to assist employees with maintaining a better mental health? Who would like to tackle that one? What are some things that organizations can do to assist their employees with maintaining a better mental health? Dr. Morgan spoke about policy. The need, well, actually, Mrs. Gordon Harrison mentioned policy, the need for policy, and Dr. Morgan said, yes, certainly within organizations, we need to put in place policies. So as you guys think about that, panelists, Caroline Graham is asking, are there any media houses in the audience? Will this make the news? Well, Caroline, it could make the news. All you have to do is make one post about it and say how impactful this was for you, and it will reach thousands of people. Caroline, help us out now. Sure. Okay, so going back to our first question, what are some of the things? I know, for example, that there are some organizations that have organized forums, such as the one that we're having. They're having motivational speakers. They are ensuring that their employees who need psychotherapy, they are paying for that. Through, I guess, the EAP programs. Are there any other interventions that you're aware of, panelists? No, those seem to be all of them. All right. I'm also aware.
I can share my screen, please. There are some more numbers. The one which Mrs. Harrison mentioned is the best one for young people, but there are others. Can you see my screen? They're all hotlines. Yes. Different agencies have different numbers, and they open at different times. For example,
please go full screen, Dr. Shetty. There you go. Thank you.
Yeah, but in case the crisis also offers an opportunity, and if you want to really change significantly, we have to look at this system which has resulted in unequal world, has created all these problems. For example, let's take Augustin, which is around the university we have. You know about the violence and so on, right? If you want to change it, take out the money in it, take out the guns in it, take out the
get three, maybe invite it and market to me. Get 3 little ones, so with $200, say $400.
Somebody is chiming in with something interesting, $200. Okay, so if you want to change
Sorry for that interruption.
significantly, you have to change the system. Imagine an Auguston where it's off the grid, everything runs on solar and wind and water. They don't pay expensive JPS bill. In fact, they can sell some electricity to JPS. They grow their own food and eat their own food and sell the rest. And they have schools which are free. They have commuting, which is subsidized or free. Then if they want to kill somebody or rob somebody, it will be out of greed, not out of need. But if you push some people beyond their tolerance, it will lead to a lot of problems.
Yeah, oh,
If you want to really change, you have to change the system.
not pay none of them. They will tell me it's tough.
Okay, I apologize. Dr. Shetty, were you through making your point?
Yes, $200, yes.
$200, okay. Okay, well, hopefully one day therapy in Jamaica will be just $200. As somebody indicated in the chat, therapy is very expensive in Jamaica. You know, it's considered expensive in Jamaica. Panelists, thank you so much for sharing your thoughts, your ideas, your expertise, your lived experiences, your everything. Thank you so much for contributing to our discussion today. I'd like to, at this time, ask Mrs. Terrain Davis, Program Director, Child and Adolescent. Oh, I beg your pardon. That's incorrect. Somebody isn't paying attention to their script. I'd like to invite Cleveland, and Cleveland Tomlinson is going to be moderating the youth aspect of our presentation today. That's right, folks. There is a youth forum. There's a World Mental Health Day youth forum under the same theme. And so at this time, I'd like to invite Cleveland to come forward and take us into the rest of today's presentation. Thank you.
is basically it's a state of mind where it's either good or bad, and if it's affected, it can affect the person in very bad ways.
Believe in positive.
First thing that comes to mind is my mental will I handle it? Especially, I know, especially during this COVID,
right.
how am I able to cope with it? As it
In the world that we live in today, there are widening health, economic, and social inequalities. Access to mental health care forms a part of those inequalities that we have to grapple with in today's society. But how do we respond to the cases of mental health? In particular, how do we respond to mental health among youth? How do we ensure that no one is left behind? How do we ensure that we provide the necessary care for those persons who experience poor mental health? I am joined here today by a panel of passionate individuals who will help us to dissect and digest the impacts of mental health on youth. We have Sharissa Pinnock, who is a first-year computer studies student at the University of Technology, Jamaica. Sharissa is a former president of the Immaculate Conception High School Debating Society and has recently represented Jamaica at the World Schools Debating Competition. She's passionate about mental health, and she is the recent recipient of the Grace Kennedy Maureen Douglas Scholarship. We also have Daniel Mullins, Open Scholar and President of the Guild of Students at the UWI Mona campus. Daniel is a multidimensional youth leader who is passionate about mental health and has interests in technology, leadership, and the arts. She is renowned as being the brightest in the field of youth and technology, and she will help us to unravel, help us to unpack, help us to discuss what are the impacts of mental health on young people in Jamaica. We also have Roxanne White, mental health advocate and student at the Northern Caribbean University. Roxanne is a chief operating officer at Mental Kit, an organization that is committed to providing godly mental health and support. Thank you very much, ladies, for joining us today. We are gathered here at a time when there are increasing cases of depression, anxieties, loss of loved ones among youth. Young people are not immune to the impacts of poor mental health. But irrespective of these impacts, there are still widespread misconceptions about mental health on youth. I'll start. Daniel, what are some of the common misconceptions that young people have about mental health?
Thank you for that question. And of course, it's always a pleasure to be speaking to any group of young people. I want to thank you for having me here. To answer your question, I think the first misunderstanding that persons have is that having good mental health means that you're happy all the time, right? And I think that that's such a huge misunderstanding because many of us are aspiring to be almost perfect. Or, you're supposed to be happy and on a high every day, and that's not true. The reality is that life is a mixture of ups and downs. There are going to be times where you're doing great, you're handling it, but there are also going to be times where you have natural emotional responses like sadness and anger and, the whole gamut of emotions, really. So I think that first step is recognizing and acknowledging that life has those ups and downs. I'm also going to have those ups and downs. But what we're looking for is a long-term kind of stability and balance. And I remember speaking with a mental health practitioner, and she was saying that, how you know that something is off is when, persons start to act differently. For example, maybe you normally get up at a certain time and instead you start sleeping out the days, or maybe you're not eating again, or it's those kind of differences that you're looking for to say, hey, maybe something is going wrong and it's a signal that I need to reach out for help. I need a support group. I need many of these different avenues. So that's where I would start off with, Cleveland.
But thank you very much for that, Daniel. And I will move to Sharissa. Having acknowledged that there are misconceptions about mental health among youth, are we doing enough to highlight these misconceptions and to combat them? Because we have to acknowledge that in trying to build awareness surrounding mental health and their impact on youth, we have to confront these misconceptions. How do we do that?
Right. So I definitely think that more can be done to help youth when dealing with these problems during the pandemic. And when we talk about the misconceptions, one of the things we know is that sometimes people think people are exaggerating. They're just like, oh, school, everyone has pressures, not knowing that these people can have crippling anxiety, crippling depression. People think that, when they say people are depressed, they think that it's something that will pass, not knowing that a lot of people don't know that depression is actually a very serious illness. When it can have a lot of psychological and even impacts on your body, and it's something that's constant and it's something that probably needs medication for. So we don't even understand. A lot of people don't even understand the difference between those things. So what we can really do is take to social media, take to the influencers that many young people look toward to try to get this message out. And within our schools, within our the universities, have these kind of forums to inform young people that, okay, this is something like UTech, UE, NCU, host these things and a forum for students to tell their issues and for dealing with ways we can get out of it or get through it, and just to understand that we're all in this together, and there are other students who are like you and who are going through the same thing, and that you're not alone in this. So yeah, that's what I think.
Thank you for that, Sharissa. Roxanne, we are considered to be young and strong with the energy and the vitality to tackle challenges and to take on the struggles in our life. And then we often hear that struggles bring greatness, and if you don't go through these struggles, then you will not become great. Should we continue to hold this kind of notion and neglect the reality that our young people are having impacts of mental health?
Certainly not. We shouldn't be holding this notion, because the reality of the situation is, if you have a wall and you keep hitting at the same spot in the wall, eventually the wall will give way. So as young people, we are strong, but the situation is that we are faced with things that are not common to us. The pandemic came, many of us thought we were the strongest things, the strongest walls, we are the Rock of Gibraltar. And then life as we knew it changed. Normally, when we're able to sit on campus under a tree, talking to our classmates and leaning on each other, we no longer have these supports. So the things that would enable us to be strong, to be able to weather the different storms that come, that's no longer there for us. So we find that the what they're telling us about we need to be strong, we're young people, this and that, it just really does not hold in a time like this. Maybe before you could say that, but right now it doesn't hold. It doesn't hold.
I contend, Roxanne, that being young does not equate to being invincible. And as young people, we have struggles, and we are also impacted by mental health, poor mental health. The COVID-19 pandemic has exacerbated the negative effects of mental health on young people. We could have converged on campus. We could have enjoyed the social spaces with our friends. We cannot do that. And certainly we are being impacted. The Pan American Health Authority and the World Health Organization continue to produce reports that young people are among the individuals who are critically impacted by poor mental health. But are we doing enough? We talk a lot about mental health. We see several young people branding themselves as mental health advocates. But are we doing it for the show, for popularity, for branding? Or do we really care about mental health? Daniel, what can we do to increase awareness of the impacts of mental health among youth?
You know, Cleveland, this may sound simple, but one thing I'm always encouraging persons to do is to be a light in the environments and spaces that you exist within. And the reason I say that is because sometimes there are people around you that are going through some serious problems, or, you know, on the verge or on the edge of so many things that we may not even know and recognize. And so I always tell students that just be a light in the spaces you're in. You know, don't seek to, you know, play out or joke around about people's insecurities, or, you know, sometimes we like to make jokes about this and that about other persons, or we see somebody struggling with something and we laugh instead of helping them. So I think that's the first thing. You have to recognize your responsibility in the wider spaces that you're in. In terms of what else we can do, I think we need to encourage persons to speak up when they're having issues, you know. I think that is something that even when we speak about how we treat young men, and we tell young men, they're not supposed to show no emotions, man's supposed to be strong and can, you know, all of those are toxic traits that we tell people to have. And so I think encouraging persons to share and be open, have sessions like this, but maybe some also more personal ones that may have psychologists or so on there. I think it's also important to note that as a young person, if you want to advocate for something, also ensure that you have those who are experts in the field also assisting, you know what I mean? So yes, as a mental health advocate, if you are one, you could get up and say, well, I'm gonna have a space and persons will come and share and so on, that's cool. But also I would encourage you to have professionals in a room that can also help with in terms person, in the case of a person getting triggered, or, you know, if the discussion gets a little bit deep, etc. That's something I would encourage. Outside of that though, when I look at our curriculums, and how we approach teaching at all levels, really, you know, secondary, primary, etc. I think we do need to build in more social skills. I think, you know, you can tell a difference when a lecturer starts a class and they do like a mood check. Students, how are you? How are you feeling? And that may be, again, a simple question and seem and come across as something that not necessarily need to be done. But I think it does have an impact. In fact, some of my best classes last year are the ones where this teacher would always ask students, how are you doing? And you may have a 5 minutes or 7 minutes, and that in turn impacts the rest of the class time. So it's all about how can we treat students as actual human beings and not just a vehicle for academic output, you know? That's important, yes, and we're gonna get those grades, yes, but what worth is all of these external accomplishments if you as a person are not okay on the inside, you know? So promoting that holistic development, promoting, even some persons have different avenues and escapes, you know, so sports, maybe that for some persons, the arts, maybe that for others, leadership and different roles, encouraging students to get involved, explore who they are, find out what kind of person they want to be in society. All of that impacts your mental health and your sense of identity and where you want to be.
I just kind of wanted to tack something onto what Danielle said. She mentioned the fact that she believes that there needs to be a greater incorporation of social skills. I think also we have to take into consideration that social media is changing how people communicate. So I think we need to re-emphasize how our young people communicate rather. And sometimes I'm talking to my peers and people just say, oh, me depressed. But when you ask them, what does that mean? And you kind of probe a little bit, you realize that they're not particularly depressed per se, but they just feel a deep sense of sadness in that moment. But the thing is, because the scope of their vocabulary, the scope of their ability to connect with what they're actually thinking and feeling and express that, it becomes a case where they're not able to. So even if you as an advocate or you as a facilitator would be able to give them some advice or bring them to a kind of space, it requires a certain level of intentionality to really pull out what they're trying to say so you can actually help them. So that's what I wanted to add to what Danielle said.
Yes, and thank you for that. And you touched on how social media drives poor mental health, and that leads beautifully into a question that I wanted to ask, and that question I'm going to pose to Sharissa Pinnock. Mental health, can be impacted by what we see on social media. As young people, we tend to compare ourselves with what we see on social media. We see someone purchasing a house, we see someone purchasing a car by the age of 23, and you are 23 years of age, and you start to feel a sense that you have not achieved something. You have not done something monumental by the age of 23. That is considered to be a part of what social media does in terms of impact people's mental health. How can we use social media responsibly to ensure that we are not being impacted in terms of our mental health?
Yeah, so what I think, again, it might seem simple, but call these things out. Sometimes you see these things and you're just, and it seems so realistic, and your friend will send you it and it seems so realistic, and because social media is supposed to make you want to click on something and make you want to seem interested, persons really just absorb it and think that it's reality, but when really it's not. So when you call these things out and say, this is not necessarily what you should be aiming for, but you should be going at your own pace. You should be satisfied with your own accomplishments. And so this really is something that you can talk about with your friends, and just having a conversation about it, talking about what's real, talking about what's not. It really helps other people to kind of open their eyes to these types of morphing, and not to be hard on yourself, as Miss Marshall is saying, not to be hard on yourself. And even during social media, this whole idea of body image, especially for women and young girls, it can take a real toll on your life, especially during the pandemic, where you probably put on a little extra weight or something here and there and not working out as much, and you don't feel comfortable within yourself, you don't feel beautiful, so your self-esteem goes down. And we really need to call out that, okay, these women don't actually look like this in real life. A lot of these women don't look like this. Having that conversation with your friend and not making them put these bodies on a pedestal is really a way to help people open their eyes and know that, hey, everybody is beautiful. So things like that, even though it might seem small, it really helps to open up a conversation about these things and help people to kind of, evaluate and reflect on what they value and what, they think is they're supposed to look like or they're supposed to be achieving. So yeah, that's what I believe.
Yes, indeed. Certainly, we need to have a conversation about how young people should digest the content that they take from the various social media platforms. Daniel mentioned something earlier, that we are not just vehicles for academic output. We are human beings with emotions. We are human beings with problems as well, and we have struggles that we go through. And I note Andre Wellington's response in the chat, where he indicated that he suffers from mental health issues and he's often considered to be weak. In school, we have students who are impacted by mental health, and that is impacting their academic success. How do we ensure, or how do well-being challenges such as stress, anxiety, and depression, how do those interfere with our academic success? Go ahead, Sharissa.
Okay, I'll go to Charissa.
Oh yeah, so I don't think a lot of people talk about how hard it is to pay attention and to stay paying attention to your computer screen. It's very easy to get distracted. It's very easy. And when you get distracted, you start to feel bad about yourself and you start to feel demotivated. And the person like, oh my gosh, I'm not paying attention in school. I have to pay attention in school. And that just adds to the anxiety. So it's kind of just like a cycle. And many children, especially persons in primary school, even people in high school, they have ADHD, which really kind of makes it very difficult for them to pay attention and not to just go off. When you're in face-to-face classes, it's kind of harder to do that because the teacher is right in front of you, so it kind of forces you to pay attention. But when you're not in school and you can easily just go off, it's very hard. And your education, especially when it's something that you really value, having to just say that, hey, I need to motivate myself. I need to find ways in order to motivate myself in order to pay attention. So there's many things that you can do, and it's really hard. But setting up a good workstation is one way that you can really increase your attention span and to get your education rolling, and to having spaces for yourself, having taken up different hobbies such as probably drawing or coloring or journaling, things like that, to kind of stimulate your mind to pay attention in school more. And because when you're not paying attention in school and when you end up failing, it's very, very, very hard, especially the amount of money that it costs and the amount of sacrifices that many people have to make for it to be there. So when you feel like you can't pay attention or you feel like there's no way you can pass, it's really something that is very demotivating. And so you have to find ways in which to pay attention and to try to get your mind back on track.
Yes, Daniel, you were saying something before. I didn't realize you were about to speak. We're talking about how mental health impacts affect our academic success. We see from time to time students have low GPAs in the context of a university, in the context of high school, low average. And we think that it might be as a result of lack of attentiveness to school, or as a result of lack of care for schoolwork or academics. But many times there are underlying issues that are impacting that student's mental health that is driving this poor academic success. Take us into those drivers, Daniel.
Sure. So thank you for the question. What I really wanted to look at was the fact that I think sometimes it's overlooked how much stress and factors are at play in a young person's life during this specific period, especially as a tertiary student, right? Number one, you're going to have that transition from, being dependent, or well, you still are dependent to some extent, right? But that transition from being young to now being a young adult and coming into your own in terms of how are you going to act now, you're now thinking about your future even more. How are you going to stand up on your own 2 feet outside of your guardians? And that alone is one shift. And concurrently, you're going to have that change in the family dynamic as well as you're becoming your own adult. And sometimes you're not able to handle that. Also, at this point in time, your grandparents are getting older. So maybe mommy and daddy have to now be doing more work in terms of helping them, or sometimes, persons pass, relatives pass. And that is also going to affect us all in a different way. Now, you throw in COVID-19, the pandemic, which is just upended everybody's lives as we know it. At home behind a screen. Some persons were depending on those social interactions in the physical space. Some persons were depending on the resources within the university, such as the library to use the laptops or the Wi-Fi. And now that you're here, now that you don't have easy access to these anymore, that has an even bigger impact on the mental health. We're also going to look at one of the main drivers as a tertiary student is 100% going to be financing and funding your education. It's not easy to fork out the whole heap of money for the tuition. And of course, it's an investment in your future, but that doesn't mean that it doesn't take a toll on you. Some students will have to take up jobs, especially given COVID-19. That's another thing we've seen, where I've seen many more students now doing part-time jobs in addition to school. So we're looking at these factors and stress levels are going up. And so we also need to ensure that we're catering to that mental health side of students, where we say, hey, this is how you can decompress. Some students like to journal. Some like to do sports, as I mentioned earlier. Some may not have been able to do sports at the onset of COVID-19 as well. But get active, stay active, ensure you're eating healthily. Some of us are doing all-nighters every night, which has negative impacts on your body over a long period of time. And I know I'm preaching to some persons right now, right? But what it comes down to, I think, is going to be immense self-discipline, almost, as one. Because sometimes we lead to our own problems when, for example, we procrastinate and don't do all the assignments on time until everything is now overwhelming and packed up, and you're just like, how am I going to do this? Also, you have to look at how much you're saying yes to, right? Because sometimes we need to say no and cut down what's on our plate because we're spreading ourselves too thin. When you reach that place of burnout, it's hard to come back from, right? So we have to start saying no and prioritizing in our life. And that may be difficult right now because as a young person, you want to be everywhere and you don't want to miss any opportunity. And you want to ensure that you're building that perfect future. But what we as young people need to remember is, even if you make a wrong step or a mistake today, you can always come back from it. There's always tomorrow. There's always a step after that you can take to find another way to get going. And so I think that's going to be just us understanding that, oh, we have a future that will be there. Of course, we can make mistakes. We're human. That's okay. But remember that you need to trust yourself and trust that regardless of what outcome may come from one step or situation or one decision that you make, it's okay because you can bounce back from it.
Certainly, Daniel, I'm looking in the chat as well, and I'm seeing where Marlene Facey is corroborating you and saying, look at how much you are saying yes to and place priorities on the things that are essential. And you would have said something about not spreading yourself too thin. I think that I became a victim of that over the course of my time at the university. Very active and involved in a lot of things. And to some extent, that would have impacted me in terms of how thin I was stretching myself, because I wanted to be involved. I wanted to do this. I wanted to do that. I wanted to become a part of the solution to the problems. But we have to ensure that we know what we should prioritize and when we should place our focus on the various things that we have to do. So when the COVID-19 pandemic came in March of 2020, it certainly impacted me, and I am not hesitant to share that I also experienced a series of depression, because there came the COVID-19 pandemic impacting an individual who is so accustomed to social interactions and social spaces and being outside and engaging in this kind of activity and doing that kind of activity. And then COVID-19 came and it certainly took a toll on me. And I did not rebound as quickly as many other young people did. It took time. It took some time for me to come back, for me to get back on my feet. And I sought, and I'm not hesitant to share, I sought help from Dr. Shetty here at our university. But there is a stigma surrounding seeking mental health care. Certainly in Jamaica, we consider if you are impacted by mental health to be mad. And young people don't want to take on that kind of stigma to themselves. So they are afraid to seek the kind of care. I wasn't afraid. I know at that time that I needed the help. So I sought the help that I needed. But Sharissa, I'm going to ask you, what can we do to overcome the stigma in terms of what they will say about us when we need to access mental health care?
Well, Cleveland, I just wanted to interject before we go into the conversation about stigma. Daniel mentioned some things as it relates to self-discipline, focus, but there's something that I always like to say, and some of my colleagues who are here can attest to that. When one of the things I think is fundamental for us in university or as young people to get through the different mental health challenges that we experience is have accountability. I always say that healing can only happen in community. When you have a community of friends or family members who really love and support you, it makes it easier for you to take up your phone and say, Cleveland, I'm having a bad day. I'm struggling with a particular class. So what has been very helpful for me, even before COVID came, because prior to COVID, a series of things happened and then COVID came and made it so much worse. What was helpful for me and what continues to be helpful for me is having classmates, having friends, having family members who I look to for different things. So you have some persons who I talk to as it relates to things for school. Then you have persons that I talk to as it relates to how I feel, because you mentioned earlier, you're 23, you see people buying a house and whatever. I'm no longer 23. I look like 18, but I'm no longer 23. So sometimes I get caught up in that space where I expected that I should or would have been further ahead. And that gets to me sometimes. I sometimes have to take up my phone and call somebody and be like, this is what is happening to me today. And in addition to the accountability, every school have a counseling department, as far as I know. If there's a school who doesn't, that's something that we need to lobby for every school to have. But every school has a counseling department. Use a counseling department. Sometimes you just need to tell the counselor that I'm struggling in classes. It doesn't always have to be, oh, I lost my job, or I lost a family member. It doesn't always have to be something huge and catastrophic. It's usually the little things that add up and have a big impact over time. So that's what I would add to that piece on how we can maintain our well-being.
Yes, we certainly need to break the stigma surrounding seeking mental health care. There's nothing wrong with acknowledging that you're experiencing struggles and that you may be in need of help. I did it, and I want to say loudly, proudly, and boldly that there is absolutely nothing wrong with seeking mental health care. And if you discover that you are in need of the kind of care that will take you out of the state that you're in terms of depression and anxieties, seek that kind of care and shut out the stigma, shut out the noise, shut out what they will say about you. I'm looking in the chat and I hear they say, I see that from Ashley, we need to take hold of the small things before the final straw breaks our backs. Definitely, the conditions that we experience can get worse, and we need to tackle them when they have just started before they get worse for us. Are we having the mental health conversation at the right age? I want to pose the question to our panelists. What is the best time or age for us to begin to talk about mental health? And this responds very nicely to what we heard from Ashley that says we need to tackle the small things first. Children also have several drivers of poor mental health. They are in unstable families. They experience different forms of abuse at home. And there are several other factors in the unstable family condition that they exist in that continue to impact their mental health. Sharissa, at what time should we have this mental health conversation with our children?
People can have it as early as possible, or they're cognizant to understand these things, because in primary school, a lot of children could benefit from having that conversation with their parents. A lot of parents can, again, this stigma, we've heard it about mad people. We've heard it for as long as, I'm sure all of us in here has heard it. In primary school, they talk about mad people. In primary school, they talk about all these things. And children especially, they don't have the capacity to understand a lot of things. They don't understand why they're feeling this way. They don't understand why their mom and their dad is arguing. They don't understand a lot of things. We have to understand that we can't leave them behind in these conversations, because if they get left behind in the future, it's going to have a lot of effects on them. So speaking to them at that age, speaking to them how they can cope and how they can understand that being even I know some people with education, the pressure they have. I remember during GSAT, someone literally went to the bathroom on themselves during GSAT because they were so nervous. That is not something that a child should be experiencing at that age, literally. So we need to tell them that, pressure on education, it should not be like that. We should know that school is a place to learn, and tests are a thing to learn, and you're supposed to actually be getting better and not just a number. So when we only focus on that number, it has a lot of bad impacts on children. And so when we tell them that it's okay not to be okay, it's okay to fail and get back up, it's okay to do to talk to your mom, to talk to your dad about these things. And even when we talk about to little boys, where we see little boys like, oh, a boy's not for cry, all of those things. 10-year-old boys, 11-year-old boys are supposed to act like they're macho, are supposed to act like they are men. That's not a rhetoric that should be, perpetuated in society. So when we tell children and we inform children and console children about the different mental health, I think that we're going to have a better population in the future. So yes, I think it should start from as young as primary school.
Yes, certainly, as well. And you would have touched on what we're doing to our boys and the expectations that we have of our boys at that young age. And we're going to get into that conversation shortly about toxic masculinity and its impact on mental health. But before we get to that, I am seeing a lot in the chat where it's referring to expression and expressing themselves. Are we providing the space at home for our children to express themselves? Oftentimes, children want to say something, we shut them up. We tell them go inside. We tell them to take up them book. We tell them to go do something else. But should we change this? And how can we change this, Daniel?
To be honest, it's all about compassion. And ensuring that we're very conscious of the language that we use when speaking to children, because that's literally the language that they're going to embody, embrace, and become in the future, and also start telling others, right? So as we're being conscious of who we are in this space, that's why I said, be a light in the spaces that you're in, and encourage young kids when they're feeling emotions, like talk with them through it. I think something that persists from youth straight up to the adulthood is that some persons have never had that space and that chance to say, I'm feeling angry right now, and to just stop and do that self-assessment to say, what is causing this? What is triggering me? What is the real root of the issue? Instead, we tend to maybe lash out immediately, start cussing people, etc. And I think when somebody, is cussing you or is angry at you, we also have an emotive response, and it just goes badly. Whereas if somebody comes at you with any strong emotion, whether it be anger or sadness, etc., I think we need to pause and I give that person the space to explain or speak to what is going on. But that takes a lot of, I suppose, also self-discipline, right? To also stop and recognize when somebody else is lashing out or having a moment, etc. Recognizing that we are human beings again, and there may be something that's causing that, right? So again, giving young people, especially young kids, that space to just speak to, ask them what's up, ask them what's happening, be very gentle and calm and kind. I saw one video online with a parent who, I guess the child was having like they're extremely angry, like an episode, and they're lashing out, and the parent was so calm with the child. Literally, she stopped him. She put her hands on his shoulders and said, what's going on? Breathe. And they did some breathing exercises, in, out, until he was calm again. She said, what's going on? You get me? So that is one response that you can have, as opposed to also getting angry with the child when they're lashing out, which goes nowhere and does not help the situation, and actually teaches the child that if I'm feeling an emotion, I need to hide it. I can't share it with anybody because it's also going to make others, So I think patience and compassion is needed in parenting, and not just parenting, but I see teachers as a second parent, to be honest, for all children. Because that's a space that we spend a whole lot of time in the education system. So that we need those spaces for patience and compassion.
Yes,
I think.
Oh yeah, go ahead, Roxanne.
I think, so let me give you an illustration. Right now I have on this pair of glasses, right? I am seeing through a particular lens. If I were to put on Cleveland's glasses, I probably won't be able to see a thing. Based on what Cleveland's issue is. And so for many people, our parents included, the teachers, part of the reason they're responding to the children the way they do is because they're responding from their rose-colored lens. We have a situation where many of our teachers, many of our parents have not begun to address their own issues. And so when the child comes or the child is responding a certain way, they project on the child versus because they're not able to see past their own issue, past their own pain, past their own challenge during this time, then they lash out on the child. Mommy, forgive me in advance, but I can only talk about our experience. So when I was younger, my parents, they had different viewpoints. So sometimes mommy would be on ABC, daddy's on XYZ, right? And being the child that I was, I took on a lot of stuff to myself because for whatever reason, I don't know why, look at me, feel like me be responsible for everything that's happening in the world and responsible for everybody's happiness. And based on some of the things that were happening, there would be points in time when I was being bullied at school or just had a really bad day. And I wanted to have that conversation with mommy, but mommy come from work, mommy tired. She and daddy on two different spectrum. My brother, him, is a whole drama. And so at the point in time when I wanted to have that conversation, she wasn't able to have that conversation, right? And fortunately, we have the kind of relationship where over time, we have been able to work through some of the things that would have affected me from being that 4-year-old or 5-year-old. But one of the things my mother always said to me was, express yourself. My way of expressing myself was book, pen. Mommy will always tell you, I have a book and a pen. So I would write poems, I would write stories, and then she would see them, she would read them, and she'd write me little notes because I responded to that. So I believe that we as adults, we as big sisters, as aunties, as teachers, we need to take some time to unpack our things. So the more we unpack, the more we become available for our children to express themselves and be themselves with us.
Yes, it is certainly unfortunate. You want to say, Sharissa?
Oh yeah. So one other practice that growing up, my mother used to do, if my mother had a bad day and she was like particularly rough with us, she would, after she calms down, she would be like, I'm sorry, like I shouldn't have shouted at you like that. And I realized when I was talking about that to my friends, they're like, your parents apologize to you, really? A lot of people, parents don't apologize to them. They don't say I was wrong here, and they don't take accountability for their actions, thinking that children are like second-class citizens or something. But when you develop that relationship with your parents, that trust to know that they take accountability for themselves when they know they're wrong and they don't just treat me awful all the time, it cuts the cycle where persons grow up and think that just because they're children, you're supposed to treat them awful and they need discipline no matter what and all of those things. We raise our children how we are raised many of the time. That cycle continues. So if we're supposed to cut that cycle and realize that, okay, you can treat your children with respect, not because they're children, they don't deserve respect. When we go on to have children, this generation, their generation can be raised with better mental health. So that's why I think, take accountability for your young ones.
Certainly, we need to look at parenting styles and how our parents go about raising children. It is very unfortunate for a child to experience poor mental health and, coupled with that, be deprived of the family space, the comfort of speaking to his or her parents to help to resolve those mental issues that child is experiencing. So I contend that at the national level, perhaps we need a higher level of education in terms of how we educate our parents on raising our children. But certainly we need to do more, because many of the problems, they start at the home. And if we can fix some of the things that happen at the home, I am sure that we can mitigate some of the mental health impacts that our children suffer from. I want us to take the conversation now into looking at how boys in particular are impacted when they are told that they're not supposed to express themselves. We live in a society where our boys are told to be macho and they should act like a man. And that definition of acting like a man involves not expressing your emotions. And I ask myself the question, aren't boys human beings? Do boys have emotions? Why shouldn't they be allowed to express themselves? And we hear from time to time people talk about combating toxic masculinity. Certainly, Member of Parliament Orlando Terralong is one of the vocal voices on combating toxic masculinity. But I wanted to take us further into dissecting the impact of toxic masculinity on our boys in school. Roxanne, I'll start with you.
Well, when you spoke about that, I don't know if it's because of a recent experience I had. I feel like it depends on what the situation is, where there's a focus on boys versus a focus on girls. Because while boys are told, oh, you need to toughen up, you need to be this, you need to be that, at the same time, I sometimes feel like they get an opportunity to act out, and people will say boys will be boys, whereas if the young lady or the girl acts out, then the response that she gets is vastly different, because a girl doesn't get to be a girl. She doesn't get to be the emotional individual that she is. But I do acknowledge that toxic masculinity is really a thing. And I don't know why people feel like it's not masculine or it's not strong to acknowledge your emotions and cry. Like any woman who is emotionally stable on a level will tell you that one of the most endearing things is to be able to see a young man who is able to acknowledge what he's feeling, speak about it, and be like, oh, I need a hug. Or I just need you to sit with me and whatever. So there's a lot of work that needs to be done in our homes and even in our churches, because we are, as Jamaicans, we are a predominantly Christian society, and whether or not we want to acknowledge it, based on interpretations of the Bible, there's this theme of patriarchy, the strong man, the man needs to do this and the man needs to do that. And our poor boys are not able to go through the layers that is involved in all of that. So I really, really feel like there needs to be more in homes where they're not, men or the women are not able to teach the boys how to express themselves. Because, there's so much and no more that a mother can do for her son. that's where the community, and it goes back to community, like I was saying before, that's where the men in the community come in, where you see a young man who is acting out a particular way. Clearly he wants to express himself, but he's not being allowed to. Take him under your wing. If you have a little, if you do some construction, carry him from the construction site with you, and while you're there, you teach him the skill, but at the same time, it gives him a channel to let out that extra emotion. So by the time him reach home, him just chill. And then he has somebody to look up to, somebody that he doesn't want to disappoint, somebody that he can go and talk to when he's feeling overwhelmed. So I just really feel like we need to get back to the village raising a child situation. Like that would be very helpful in raising our boys. The village needs to go back to raising the child versus leaving the single mothers or the single fathers to raise the boys alone. Like, it really not work for me.
Yes.
And
Daniel, go ahead, Sharissa.
I was saying that there's no surprise when during the pandemic domestic violence increased significantly for women worldwide, and it's because of the patriarchy and the hypermasculinity, where a lot of people lost their jobs, a lot of people that lost their livelihoods, and so when we teach men that the only way to be a man, you have to be able to provide, you have to be able to dominate. When they can't do that, they look for dominance elsewhere. And so we see where they lash out against the women in their lives, and they lash out against their the children. So if we take a step back and realize that teaching men this rhetoric puts a lot of pressure on them. If you see in Jamaica, I think last time I checked the statistic, probably 3 years ago, 89% of the suicide is men. So we have to realize that when men don't have an outlet to express their emotions, they bottle it up, and then it just becomes too unbearable to them. Whereas women, it's acceptable for them to speak about their issues. They go to the nail salon, they speak about their issues. They talk with their friends about their issues. It needs to be normalized that within friend groups with males, they need to realize that they can have avenues to speak about themselves and not be ridiculed and not be told that they are sissies or whatever, because it's going to affect men, and it is then going to affect the women and the children in society.
Yes, we should reject the notion that boys that express themselves are boys that are weak. They have emotions as well. And I contend that when we prevent them from expressing their emotions through talking and through what we would generally consider to be soft, then they will bottle up that emotion, and then they will express the emotion in ways that we do not want them to express it, through violence, through other kinds of unpleasant means of expressing their emotions. So certainly we need to reject the notion of weak boys are boys that express themselves. Daniel, we are coming closer to the end of our panel discussion, and I want to ask you, Daniel, I'm going to get a take from the other panelists as well. Where can young people access services? Where can they go for help? I certainly accessed help through the services provided by my university, UTech Jamaica. So that is one space that we can access services. But go ahead, Daniel, tell us, where else can we get that kind of much needed help?
Sure. All right. So number one, as you mentioned, would be your educational institutions. As you said, UTech offers, the University of the West Indies also offers through the health center. And there are two ways. One would be you can actually sign up. So a chat line of sorts. So it's called UE Helps, and students can actually message in. And through that, they've even derived some statistics. Like, for example, on Sundays is the busiest day in terms of students messaging in. So that's one, your educational institution. Two, I do know that the Ministry of Health, in collaboration with UNICEF and U-Report, will soon be launching, if it hasn't launched already, their mental health chat line for young people. So from the perspective of the Guild, we're also partnering with them to ensure that the students at the University of the West Indies can access, but I'm sure any student can access once they're within the range of ages. So I'll also speak with Robin and see how UTech can also ensure on the front lines of working there. The third space I would say is, we all need support systems. And maybe this is not professional help, but I really do encourage persons to ensure you're building out a support system of people that uplift you and are willing to reaffirm you in those moments that you're not sure of who you are, you're not sure what's going on in your life when life feels difficult. And that takes time to build those kind of friendships or those kind of family relationships, etc. That will be there for you when you're feeling down. And you have to do it from now, from when you're good, right? You know, in preparation for those days where you may not be yourself. The other recommendation I would put forward is some people like to journal. I personally journal a lot. I love journals. And that helps me to just put down on paper in words to really understand how it is that I may be feeling right now. And so, of course, that's not a professional means or so on, but it is one way that helps me keep sane with my mental health. The last point I will put out there is, especially as young people in the tertiary space, I think sometimes we can get so booked and busy. You know, my mom always says to me, Daniel, be careful of booking yourself out of your own schedule, right? You're doing so many events and TV and guild and that sometimes it gets difficult and it does get hard, right? And so one thing I've taken from her is that I intentionally schedule rest and break sessions into my overall schedule. And so, yes, you know, it's funny because somebody may call you and be like, are you busy right now? And you'd say yes, maybe if you were in a meeting or in a school event or so on, but you wouldn't say yes if this is your scheduled break time. Like, actually take a break seriously, because if you're not going to set those boundaries, nobody else can set them for you. So boundary setting, ensuring that you have rest in your schedule, that's going to be important. So those are the avenues I would put forward right now.
Yes, Sherris, I'll take from you as well, and then we proceed to wrap up our discussion here today. We are having a very important conversation on mental health and its impact on youth. Sherris, I'm asking you, where can young people access services to help them overcome poor mental health?
Yeah, so I think Daniel did a really good job of saying it. But another way that, you know, people can, young people in general can get back their mental health is through, you know, going to church. So a lot of people, they don't believe that they're religious, or they don't believe that they're, you know, church is their scene. But Jamaica has so many churches, and it's for a reason. Even if you're not the most religious person in the world, what church can do is they have this community where it's so supportive and it's so uplifting that when you go and you immerse yourself, it gives you a sense of hope. It gives you a sense that people out there, there are people out there who care about you. There are people out there who want to see your well-being good. So what we want to see is more young people being, you know, being involved in their church and involved in their church services. And again, taking personal time for yourself. So things such as meditation, things such as, you know, just listening to music and taking that time out for yourself is really, really important, because your mental health is the most important thing for you. And when it's got bad, it affects your whole life. So that little time of mental health, personal time can make a huge difference. So yeah, I think Daniel really took it, but yeah.
Yeah, I have a couple more that I could be able to add.
Yes, go ahead, Roxanne, and then that will be, the final question posed to our panelists today, and then we'll proceed to wrap up.
Okay, no problem. So Daniel did mention that the Ministry of Health, they're working towards something. I do know that they had launched a mental health hotline, 888 New Life. Okay, I think I accidentally muted myself. So that number is 888-639-5433. So that's the mental health line for the MOH. Also, there's an organization called Think Mental Health JA that has free support sessions. I believe it's every 2 weeks or every other week. They have free mental health sessions. So you could check them out on Instagram. They usually post when their sessions will be, and remember, it is free. So capitalize on that. I think they also do a partnership with JAMAN, I'm not remembering fully what the acronym is for, but JAMAN also does support sessions that, and I think Jamaica posts them as well. So that's definitely something that you can check out. And Sharissa mentioned churches. There are some churches that offer counseling sessions through their family life department. I definitely know as an Adventist that they definitely do that through the different conferences, through the family life department of the various churches. So those in addition to what the other ladies have said are ways that you can actually get support that's free. Of course, you know that there are therapists that do charge, and unfortunately, I don't know that there is insurance that covers that, which is something that we would recommend for the government to have a policy around that. Just like where you can go to the doctor and get insurance, there should be like some mental health insurance that persons can tap into. But yeah, that's it.
Yes, I want to thank our panelists very much for helping us to look at the impacts of mental health on young people. Young people are not immune to mental health disorders. And at the national level or the university level, wherever we are having the conversation about mental health, then we must have that conversation about youth as well. And youth should be involved. Generally, right across the board, we should encourage youth involvement in the discussion and the crafting of solutions that will respond to mental health challenges. I contend that there is no national development agenda that can be adopted by any country, successfully achieved or sustained without the inclusion of young people and their active participation. And on the matter of mental health, certainly we need to have more conversation about its impact on young people and how we can mitigate these challenges. Thank you very much, Daniel, Roxanne, and Sharissa. There is a survey that has been placed in the chat. And if you are desirous of pursuing a Masters of Science in Health, Communication, and Media Technology, you should go ahead and complete that survey. The host admin has just placed it in the chat. So that is if you want to pursue a Masters of Science in Health, Communication, and Media Technology, I invite you to go ahead and complete that survey. Thank you very much. Let us continue to have conversations surrounding the impacts of mental health on young people, a very important demography in our society. I'm going to hand over now to the individual who will present the vote of thanks today.
Thank you very much, Cleveland. A big thank you to Dr. Isuza from the Mental Health and Substance Use Department, PAHO headquarters, for enlightening us on mental health status in the Americas. We are really grateful and appreciative of the importance of a whole society approach that is needed to build mental health services as an essential support recovery post-COVID-19. The allocation of adequate funding for mental health services, and the need for primary health care providers to be trained in psychological first aid is absolutely important. Thank you, Dr. Isuza, for delivering the guest presentation. I must mention our deep sense of appreciation to Professor Charmaine Barrett, Dean, Faculty of Education and Liberal Studies, who brought us greetings from the university. We are thrilled that UTech Jamaica support very important events such as this one. Further, we are grateful to our moderator, Mr. Craig McNally, who so ably facilitated the panelists comprising Dr. Shetty, Dr. Morgan, Mrs. Gordon Harris, Ms. Janelle Brooks. No money without honey, emphasizing the need for increased budgetary allocation to provide mental health services to the population inclusive of our children who are a vulnerable part of our society. Thank you, Mr. McNally. and panelists. I would also like to express our sincere thanks to Mr. Cleveland Tomlinson, our youth section mental health moderator, and his panelists comprising Danielle, Roxanne, Sharissa. Mr. Tomlinson, your performance today truly embodied the caliber of graduates produced by UTech Jamaica. And to our panelists, we did not just hear you. Rest assured that we listened to your concerns and your recommendations.
Cannot take a vaccination.
I also wish to express my gratitude to our students and staffs who took part in our Vox Pop recordings. Your contributions added much flair to our virtual event this afternoon. Ms. Chairwoman, Dr. Kenisha Nelson, ladies and gentlemen, an event like this cannot happen overnight. The wheels started rolling weeks ago. It took brilliant planning and a bird's eye for details to produce such an event. We have been fortunate enough to be backed by a team of very motivated and dedicated colleagues at UTech Jamaica who know their job and are result-oriented. Ladies and gentlemen, this afternoon event would not be possible without the hard work of the planning team. So at this time, I would like to express my deep appreciation to Miss Marilyn Lacey and her BCAT team, who ensured that the production of the event went smoothly. Ms. Roshan Jarrett, who played a major role in the planning and execution of activities to recognize the 2021 World Mental Day event. I cannot thank everyone for their involvement and their willingness to take part on the completion of tasks and went beyond their comfort zone in making this afternoon session a reality. We also would like to acknowledge our gratitude to all the participants for tuning in and taking part in this afternoon's event. Your involvement in the chat, your feedback was truly appreciated. We were indeed inspired by your presence in this afternoon session. As we bring this wrap on this event, ladies and gentlemen, please continue to keep safe. And I wish you all a good rest of the day. Thank you very much for being here.